So hi again. My name is Fion Chang. I'm a second year medical student at the University of South Alabama. And today I would like to talk about our project on trying to implement point of care ultrasound or POCUS into our student run free clinic. So a little bit of a background. Hopefully that works. Um, so POCUS is a portable handheld ultrasound device, and you can see this is just an example here. They come in many different forms, but usually what they have is it's kind of like a phone screen. It's about a size about a phone right here, and it's attached to the probe where you can look at the images just and act like just like any other ultrasound machine. It's not as expensive compared to like a more traditional ultrasound, but it still gives really good images and can let us see like musculoskeletal injuries, some heart and lung problems, some GI pathologies, and also kind of monitor some OB/GYN care. It's been shown to be really helpful as a learning tool for medical students, and we think that it could be helpful in improving diagnostic access, especially in a more resource-limited clinic. And we wanted to see if it's more possible to implement this into a student-run free clinic where the majority of us that's providing the care are medical students. So what we did was we had our university hospitals radiologists come in to teach us how to properly use the POCUS machine. And from there, we implement as like a pilot study to see if actually it's possible and have surveys and discussions on what worked well and what didn't work so well. And so what some things that worked really well, and I have to give credit to our amazing treasurer that somehow found our sponsors to give us a lot of fundings to get these POCUS machines. So that part was very easy relatively. The student volunteers were all really motivated, so it did help make the entire training process run smoother than we expected. Now for the challenges and what we are more interested in. Even though the students were able to properly use the POCUS machine and get really good images, we had a little bit more problem trying to interpret the images. And especially the main problem was we mainly trained on each other, and most of us are healthy. Like we don't have a broken bone or anything. We can't really see what's going on. So we didn't know what something abnormal would actually look like. The other problem was we didn't have a standardized protocol. So oftentimes when a patient comes in, we don't really think about, oh, this patient could use POCUS, even though we probably could have used it, and trying to see what other systems there are. We mainly looked at musculoskeletal injuries, and we kind of miss out on the other systems that we mentioned, like the GI, the heart, the lungs that we could have looked at. And finally, probably the most concerning for us was for some patients, even though we were able to diagnose and see what the problem was with the POCUS machine, our clinic didn't have the capacity to actually give the care that they need. So oftentimes the patient will be lost to follow-up either because we didn't know who to refer them to, or they just say, ah, it's not that big of a deal, and they just walk away. So our conclusion is that we do think that POCUS would be really helpful in implementing into a student-run free clinic. There are obviously challenges that we need to address. And this here is just, let me zoom in a little bit more. It's just like a step-by-step guide of what we hope this project goes through. And this project is on step one, where we try to figure out what are some problems, what are some things that could have worked better. We're currently working on step 2 and 3, where we're trying to improve the training so students can kind of move more independently and trying to interpret the images by themselves a little bit better. And we have been working on trying to make protocols so we can use it in clinic a little bit better. We actually have a MSK protocol ready. There's some finer details that we need to work with our emergency medicine doctors with, but it's pretty much ready to go. So some things to consider though is maybe it's because we don't have a standardized protocol yet, and maybe it's because the students aren't as trained on how to interpret the images, but POCUS implementation did slow down our workflow quite a bit. And this is especially a problem because usually we only have 1 or 2 qualified physicians at the clinic at one time, and them having to run back and forth and trying to say, oh, this is this image, and can you try to do the POCUS thing again? And that did slow everything down quite a bit. And the other thing is because we didn't have the treatment options available for the patients, it did make us think whether or not it's more practical to just send patients to a more established clinic in the first place so they can get more advanced diagnostic there and also get the care there. So for our future directions, it kind of goes back to that image that I showed on the conclusion section, but we're trying to improve the training for our students so we can look at the image interpretation by ourselves a little bit better. We have been working on protocol. We have also been trying to connect more closely with our local clinics and hospitals to try to better refer our patients to them. And these are just our references. And that's the end of my presentation. Thank you so much for listening.
Yeah, very, very nice presentation. I think a lot of specialties is actually doing this, and I guess we're actually going to have something at the SMA about ultrasound, because ultrasound is changing everything. Now, are there some questions concerning this?
I have one question. But let me make a comment first. On the SMA.org website, we have a lot of educational content on portable ultrasound or point of care ultrasound. I'm sorry. We also have a podcast called Southern Medicine that if you subscribe to, we have several cases where POCUS is used. So if you subscribe to that or get a chance to look on the website, we've got a lot of content in this area. And Dr. Angel is exactly right. We'll also have a hands-on workshop at our annual scientific assembly in November in New Orleans. So you're not too far from there.
Yeah.
I do have one question here from the chat. POCUS has widespread uses in a free clinic setting, but isn't indicated in all cases. Can you briefly speak about the inclusion or exclusion criteria for free clinic patients?
I think that's what I meant by we don't have a standardized protocol and what we have been trying to figure out when to use it. For us at our clinic, at least, we mainly use the POCUS machine for musculoskeletal injuries. So if we had patients come in with like a knee pain, then that's when we think, okay, we can use this POCUS machine right now. We probably could have used it on a lot of other patients that come in, say chest pain, maybe abdominal pain. Maybe that could have led us to look at maybe for gallstones, but because we didn't have that protocol established in the first place, we didn't really think about it until much later. It's like, oh, we could have used that. So yeah, we miss out on a lot of opportunity to use it, and that's where the regret kind of comes in. It's like, oh, we should have had that protocol. So that's what we're trying to work on now.
Yeah, very good. Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.